For the out-of-town patients, the general timeline is as follows. Most patients arrive in Baton Rouge on a Thursday or Friday morning. On the Friday before surgery, you'll have an MRI at Pennington Biomedical Research Center. You will also have a pre-op visit at our clinic. At this visit, I will take a history and physical. You'll have baseline x-rays taken of your knee using size markers as a control for comparison to films taken after surgery. We will also give you a CPM machine. CPM stands for continuous passive motion. You'll use this machine after surgery to flex and extend your knee for 2 hours a day, and you'll do that daily for the first 4 weeks. The surgery is typically on Monday morning. Depending on the size of the damaged area to be treated, the surgery typically can take anywhere from an hour and a half to 4 hours, and that's for knees. For hips, it's longer. It can take up to 6 hours. Surgery for the knee study is always done outpatient, and for the hip study, patients may be hospitalized overnight depending on the length of the surgery. The day after surgery, you rest, and there are no study procedures that take place that day. On Wednesday, you return to the office, you have an MRI done, and we'll go over your surgical findings. You're free to bring a USB drive for that visit if you want to make a copy of your surgical videos and pictures. You'll also start physical therapy that day, and you'll start using your CPM machine. For the next week, you're using the CPM daily. Stitches are removed around a week and a half after surgery. About a week after surgery, you'll begin your post-operative injections. During that procedure, you lay face down on the exam table. We use a lot of lidocaine to numb up that area on the back of the pelvis where the bone marrow will be harvested. The bone marrow needle is then inserted in the pelvis. It's called an Illinois needle. It's not the typical very large bone marrow needle that you may see if you Google that on the internet. It's a lot smaller. It's uncomfortable, but patients typically don't complain about it. Patients tell me that the most uncomfortable part of it is actually drawing the bone marrow out, but that doesn't take very long. The bone marrow is then processed to yield the cellular layer, which contains stem cells. And we also draw blood and process it to obtain platelet-rich plasma. Those two components are then mixed with hyaluronic acid and injected into either the knee or the hip. Those injections are done weekly for the first 5 weeks. At 4 months, you'll have an additional series of 3 weekly injections, and then again at 1 year, you'll receive a final series of 3 weekly injections for a total of 12 injections, counting the one that you get during the surgery. Patients stay in Baton Rouge for the first 6 weeks of the study. It's important to do your initial therapy with physical therapists that are specially trained in Dr. Saul's techniques. He feels like the physical therapy is one of the most important parts of the process. An illustration that Dr. Saul uses is that these same cells will turn into bone when they're injected into an immobilized fracture site. However, when they're injected into the knee, as in this case, and the knee is moving and you're doing the physical therapy techniques, those same cells turn into cartilage. We have a special arrangement with a hotel for a reduced rate. The hotel is located very close to the clinic, and the rooms are suites. After 6 weeks, you can return home. You will need to continue to do physical therapy, so we will communicate with your therapist at home regarding the protocol and your progress so that they can effectively take over your therapy. You'll return to my office for follow-up visits. The exact protocol for each of those visits varies slightly, and details are included in the consent form located on our website. Thank you.